Hey there, welcome to Grow Med. This channel is a one-stop guide for the FMG aspirant. Here you can find everything you need for the FMG like the mnemonics, then the previous year questions, the important topics, the revision videos, everything. So if you're new to GrowMed, subscribe to GrowMed and tap the bell icon to get regular study tips. This video will be a short revision video covering all the important topics and points from the psychiatry which are asked in the FMG. So I will be covering the previous year questions and also the important topics which are likely to be asked in the future. I had already uploaded a video on the biochemistry, the 4-day revision videos. So like that, I am gonna do it for all the subjects, as it was helpful for most of you, and I was also getting DMs regarding it that do it for all the subjects. So for big subjects like the OBG, then the surgery, medicine, it will take a little bit of time. So in between of that time, I tried to complete the short subjects, so at least short subjects will be perfect for you all. Okay, so this will be a 2 or a 3-day revision plan for the psychiatry. I will provide these notes in the Telegram. You can follow these notes. But if you have already read the psychiatry from any of the source platform, online or offline, any coaching, then you can follow those notes as well, because the content is the same, only the language will be different and few points will be there which will be missing, so you can add those points as well. Okay, so what you need to do is that I will be posting a video daily morning. You will be watching this video, and after watching that video, it will be like 20 to 30 minutes video. After watching this, you need to read the notes and then solve the MCQs. MCQs from any platform like the Marrow or the FMG solution. FMG solution is actually best because it is having most of the previous year questions. And if you are going to any coaching, then the coaching subject wise tests are there, so you can even do that. So you need to just solve the MCQs. You can solve it from anywhere. Then after completing of this revision session, I will be providing a PDF of the MCQs for you all to solve it. So you can solve it and come to know that how much you have learned from it and how much you are able to remember, recall the things. Okay, and that PDF will be consisting almost the previous year questions. So let's get started. So let's start the discussion. So we will start from the basics, like the main two disorders which are very basic, and if you start from here, then you'll be able to understand everything. So the brain disorders, they are mostly classified into the organic mental disorders and the functional mental disorders. So as you can see here, organic means there is insult present to the brain, means anatomical defect, something anatomical changes have occurred due to which this disorder is occurring. And functional means there's no anatomical defect or there's no insult to the brain, like for example, there was a road traffic accident and after that the patient developed certain diseases, so it will be organic mental disorder. Or there was due to the age, there will be deposition of some particles, like in case of dementia there will be atrophy of the muscles, so atrophy of the brain. So this will also be an organic mental disorder. But functional means these are not dependent on the anatomical structure, they develop by themselves. Okay, there is defect in the functioning of the brain, and these are usually seen in the young, and the organic mental disorder seen in the elderly. This will be acute condition, and the functional mental disorders, these are slow, so they develop over years and they are progressive. Okay, slow and progressive. So the two main important terms present in the psychiatry, the delusions and the hallucination. So we will also discuss about these. There are various types of delusions and various types of hallucination. So this is the basic concepts and we will discuss those also. The delusion and hallucination, these are present for the short time in case of organic mental disorder, and in case of functional, these are present for a long time and they are constant. Okay, then there is a loss of consciousness seen in case of organic mental disorder, and you can see here that it was a previous year question that in organic mental disorder, which of the following is seen, or loss of consciousness is seen in which of the following disorder. So the answer was the organic mental disorder. Okay, and also the another question is hallucinations. So in both the conditions hallucination is seen, but In organic mental disorder, it is the visual hallucination, and in case of mental disorder, it is the auditory hallucination, which is the more common. So you can see the examples like the neurocognitive diseases like the delirium, dementia, amnesia. So delirium means there is impairment of the consciousness. So the patient is not aware of his consciousness. He will be losing his consciousness, and after gaining of the consciousness, the person will not be able to recall the things, remember the things. Okay, then dementia means the cognition is impaired, and amnesia is the loss of the memory. So as you all know that the amnesia classified into the retrograde amnesia and anterograde. So retrograde means the patient is forgotten about the past things, so the memory of the past is lost, and anterograde means the memory which is built, which is to be built, like the new memories which are to be built about the present or the future, those are not able to be built by the patient in the patient. Okay, so he is not able to recall the recent things, then that will be the anterograde memory loss. And the diseases present in the functional are the psychosis and the neurosis, and this one is also a PYQ. The question was asked that in the psychosis, no insight is not present in which of the following diseases, and it was the psychosis. So this was the basic about the brain disorders. So let's discuss about the delusions, hallucination, and the disorders of the thought, everything. So this one, as you can see here, the criteria for diagnosis of the hallucination. So for it to be the true hallucination, then it will be these four things should be there, then only we will be calling it as a true hallucination. It occurs in the absence of stimulus. So there is no triggering stimulus or any object which will be causing this. If there is presence of any substance or any object, then we will be calling it pseudo hallucination. Okay, as I've written here, opposite to this is the pseudo hallucination. Then it is as vivid as real. So the patient feels that it is present in the real and also explains it like it is there in the real. Okay, then experienced in the outer subjective space, and it is always involuntary, means it is not under the control of the patient. So if these things are there, then it will be hallucination, and if it is not there, then opposite of this called as the pseudo hallucination. So the types of the hallucination: the visual hallucinations, then the auditory hallucinations, means the visuals will be seen. So the patient imagines that there is a person and keeps on speaking to him thinking that it is real. Okay, so it will be visual. And auditory means the person will be able to hear some noises. Okay, so this associated with the hearing pathway, these are the auditory hallucination. And likewise there is the reflex hallucination. It means that the stimulus is in one sensory and it produces hallucinations in the other sensory area. Like for example, there is stimulus is of the eye, but it is producing hallucinations in the ear, then it will be called as a reflex hallucination. So these were some things about the hallucinations which you must remember. Then let's discuss about the delusions. So these delusions, these are the disorders of content of thought. Disorder. So there was a question asked on this, that delusion is a disorder of, and it was content of thought. So this is a previous year questions. And the definition of the delusion is that it is a false belief which the patient believes, and it is firm and unshakable. That means how much ever you try to convince that patient that it is false, he will not be agreeing to you. He will be denying that you are wrong, and he will be believing it. Okay, so these beliefs are so strong, and also these are not explained by the social and the culture backgrounds. Then moving on to the types of the delusions, there are various types of the delusion. Like, so the various types of the delusion, as you can see here, that this delusion, it is a disorder of thought we have discussed, and it is a false belief. So the types: the persecutory, that means harm. The patient believes that someone wants to harm him. Okay, then the other delusion, other type is the reference, delusion of the reference, and the patient feels that someone is talking about me. Then grandeur, delusion of grandeur, it is usually seen with the mania, and the patient feels that he has a special power. The nihilistic, seen with the depression, And the desire, delusion, desire, it is seen with the schizophrenia. Like for the example, the patient feels that if he urinates, then the whole world will sink, something like that. If he sneezes, then the whole world will be vanished, something like that. Okay, so these are the examples of the delusions and the type of the delusion. So there are other two types. The delusion of love, that means a patient will feel that some famous personality is in love with him. And delusion of infidelity, that means the patient is jealous. Okay, for example, the patient feels that his husband or his wife is cheating on them, and due to which they will be getting jealous. Okay, so these were the types of the delusion. So these were some basic things which you must know from the psychiatry. Now let's discuss about various diseases. So the first disease we will be discussing is the schizophrenia, because schizophrenia is a very important topic, and you can go and see that every year this question is asked on the schizophrenia, either the clinical case or the drugs or simple one liners. So it is a must do topic. So schizophrenia, this occurs due to the imbalance in the neurotransmitter. So the pathophysiology is that the dopamine, it is increased. There is increased levels of dopamine causing these factors. Okay, so these are the fundamental symptoms of the schizophrenia, which are described with 4 A's, that is autism, ambivalence, affect disturbances, and association disturbances. So this is also a PYQ. The question was asked that all of the following are fundamental symptoms of the schizophrenia except. So you need to read the question and look at the options as well and choose the except one. Okay. So these 4 A's, they were given by the Blue. So this can also be asked that who gave the fundamental principles. It was given by the Blue, and these are the first rank systems. First rank system symptoms, and these are 11 symptoms, and this was given by the Kurt Schneider. Okay, so he gave these 11 symptoms, which are 3 thought phenomenon, that means thought insertion, thought withdrawal, and thought broadcast. That means the patient feels that some thoughts are inserted into his brain and he is not controlling those. Okay, withdrawal means his thinking or whatever he is thinking are taken by someone else. Someone else is collecting his thoughts. Okay, then thought broadcast means someone is removing thoughts from his mind and they are broadcasting it to everywhere. Okay, so these are the 3 thought phenomenon. Then the 3 made phenomenon, which are the made violation, then made effect, and made impulse. Violation means the patient says that someone is trying to control his actions. Okay, so he cannot control their actions. Then effect means emotions, someone else is controlling his emotions and someone else is controlling his impulse. Okay, so these are the 3 made phenomenon. Then 3 auditory hallucinations, like voices arguing or discussing, which is called as a third person hallucination. Third person means the 2 voices are present in his brain and they are discussing about this patient. Okay, then voices giving running commentary about the patient's action, and voices saying thoughts loud. That means the patient believes that the voices in him, they are saying the patient's thoughts, reading it out loud, so that others are also able to come to know about his thoughts. Okay, then the passivity, the patient believes that his sensations, the body sensations, are controlled by some other agency, external agency. And delusional perception. So these were the 11 symptoms which are the classified as the first rank symptoms. Now let's discuss about the symptoms. So based on the symptoms, this schizophrenia is classified into the positive, negative, disorganized, motor, or catatonic. So positive means it has hallucinations and delusions and hallucination, and it is of good prognosis. So this is also a PYQ, which symptoms if present in schizophrenia is classified as good prognosis. Okay, so this was also a PYQ. Then the negative symptoms means the avulsion, anhedonia, affective flattening, and it is associated with the poor prognosis. Then disorganized means it will be affecting the behavior, speech, and the thinking of the patient. And motor or catatonic means it will be the involvement of the motor symptoms, and the things which can be seen with the patient are like the stupor, echolalia. Echolalia means repetition of the examiner's speech. The patient will be repeating what the examiners will say. Okay. Then echopraxia means mimicry of the examiner's behavior. The patient will be mimicking the examiner, that is called as echopraxia. Then grimace means giving odd facial expressions. Then stereotype, spontaneous repetition of some purposeless movements. Okay, the patient will be doing some movements which are not of any purpose and he will be repeating it. Okay. And preservation means it is a movement which do not have a point of relevance. Okay. So these things are seen with the motor or the catatonic, and this motor or catatonic, it has a good prognosis. Now let's discuss about the types of the schizophrenia. So it is classified into the paranoid, which is the most common type, and it is late onset and it has good prognosis. Then the hephrenic, which has the worst prognosis because it is early in onset and it has poor prognosis. So the catatonic, it has the best prognosis as we discussed here, and this was asked as a question, so previous year question, that which type of the schizophrenia has best prognosis. It is the catatonic, and for the catatonic the treatment of choice is the ECT, electroconvulsive therapy. Then moving on, the next type, residual or the latent, then the undifferentiated and the simple type. The neurotransmitter defect present in the schizophrenia is that the serotonin is increased and the dopamine is increased, whereas the glutamate is decreased. Okay, so these things also can be asked as a question, that what is the neurotransmitter involved in the schizophrenia. And also they can give it as a match the following, because in depression also there is involvement of the serotonin, dopamine, and for the OCD it is decreased serotonin. Okay, so they can give some options like this and ask you as a match the following question. Then moving on to the treatment of the schizophrenia. Before discussing the treatment of the schizophrenia, we'll discuss another important thing which is asked from this, that the prognostic factor. Which things decide that it is a good prognosis and which things decide that it is a bad prognosis. Like for example, if it is a female, then it will be a good prognosis and probability are there that we can treat the patient easily. Okay, and if it is a male, then it has bad prognosis. If it is an acute onset, then also it is a good prognosis, and late onset, it is also a good prognosis. Whereas if it is chronic and if it is gradual onset, then gradual or late early onset, then it will be considered as the bad prognostic factor. Also, if there is a family history present, then it will be considered as a bad prognosis, and if there is no family history, then it will be a good prognosis. Then if there is emotional blunting present, then also it will be considered as a bad prognostic factor. Then there's another type, this schizotypal type of schizophrenia, and it is seen if a relative is having any schizophrenia. So a person in the family is having schizophrenia and then it develops to another person, then that type is called as the schizotypal. So these were the basic things of the schizophrenia, the types, the symptoms, everything. So now let's discuss about the diseases, the drugs. So we will be usually treating the schizophrenia by using the antipsychotic drugs. So the antipsychotic drugs, they are classified into the first generation, which are also called as a typical, second generation also called as atypical. The first generation, they block the D2 receptor, and that's why they are called as typical. Okay, and the atypical, they block both dopamine and the serotonin receptors. So with these things, the first generation, they are having a high risk of extrapyramidal symptoms, and the risk of the extrapyramidal symptoms is less with the second generation, but they are having high metabolic effects. This metabolic effect is seen maximum with the clozapine. So for the exact classification of this drug, that which drug falls in which category, you need to look at the pharmacology for the name of the drugs. So if you remove your pharma notes and if you learn these two together, then you will be also completing it from the pharmacology. Then questions are asked on the side effects, extrapyramidal side effects, and also how will you treat them. So let's look at them. The extrapyramidal side effects, these are the acute dystonia, which is the sudden contraction of a group of muscle, like for example torticollis, okay, or trismus. Then how do you treat it? We will be using the promethazine. We will be giving it IM. Then acute ectasia. So this is the most common symptom and this is the most earliest symptom. For acute ectasia, we will be using the beta blocker, mostly the propranolol. And then drug induced Parkinsonism, because these drugs can cause Parkinsonism. So it will be presented like rigidity, tremors and bradykinesia, and management is anticholinergic. Tardive dyskinesia, it is the involuntary movement of some muscles like the tongue, then the jaws, the lip or extremities. So the treatment of this, we will either switch to the atypical drugs or we will use the clozapine. Then moving on to the neuroleptic malignant syndrome, NMS. This is the most severe variety and for the treatment we will use the dantrolene. So clinical cases can be asked that there was a schizophrenic patient and he was taking the typical drugs, and after that he will develop the torticollis or sudden contraction of group of muscles. So how will you treat the patient or what will be your further management? So it will be, we will be giving the promethazine IM. So likewise they can ask it for drug induced Parkinsonism or acute ectasia. And also one liner can also be asked that which of the following is the earliest extrapyramidal side effect, which is the acute dystonia, and which is the most severe, it is the neuroleptic malignant syndrome, like that. Okay, so this was all about the schizophrenia. And also another very important question asked is that in case of resistant schizophrenia, clozapine is used, it is the drug of choice. This is also asked multiple times. So schizophrenia is a must do topic and you need to read all these points related to it. I hope this schizophrenia you have all understood. What does it mean, what are its symptoms and its types, everything. Now moving on, let's discuss about the depression and some other things. So the Capgras syndrome, it is the delusion of misidentification. This is also a PYQ asked multiple times, okay, and image based questions are also asked on it. So the patient believes that a real person is replaced by an imposter, okay, and it is associated with the dementia with Lewy body dementia, that is the Parkinsonism. It is believed to be associated with it. So simple one-liner case also can be asked that a person believes that his wife is replaced with another woman. So what is the patient suffering from? It will be Capgras syndrome. Then speaking about the depression, the etiology of the depression is that neurotransmitter imbalance, and the neurotransmitters involved are the dopamine and the serotonin. So there is decrease in the dopamine and the serotonin due to which this depression will be occurring in the patient. So I forgot to discuss one thing here in the schizophrenia, that the drug of choice for the schizophrenia. So this is also an MCQ previous year question, drug of choice for schizophrenia, and it is the olanzapine. And the drug of choice for the resistant is the clozapine. So do add these points in your PDF also, and if it is already there then no need to add it again, okay. So we were discussing about the depression, right? So this was about the depression. Now to make the diagnosis of the depression, there are certain things required, like there should be more than 5 symptoms present of the given below, and it should be present for more than equal to 14 days or 2 weeks, then only it will be called as the depression. So these are the key features, key symptoms of the depression, and this is the low mood. So low mood is the key feature. So low mood itself is enough to make the diagnosis of the depression, because the patient is not interested in doing any of the things and he feels alone and depressed, okay. So the other symptoms less energy. The patient will feel that energy is less and he will be feeling weak, then decreased sleep, decreased weight, decreased psychomotor, and anhedonia. Anhedonia is also a PYQ. So the question was asked on its definition. What does anhedonia means? So it means that in the previously enjoyable activities, the patient is now not able to enjoy them. Okay, like the patient used to enjoy dancing but now he is not able to enjoy dancing also, or the patient used to love singing and he used to usually keep on singing but now the patient does not like to sing. Okay, something like that. Then the other symptoms will include the suicidal thoughts, then the concentration, loss of the concentration, feeling of guilt or worthlessness. And for the treatment of the depression we will be using the antidepressant drugs. So it is better if you do this part from the pharmacology, because you will be covering there all the things like the mechanism of action of the drug, the classification, and along with that the side effect of the drug. So everything will be covered, so it's better to do in the pharmacology. And the other two treatment modalities are the ECT, electroconvulsive therapy, and the CBT, cognitive behavioral therapy. So that's all you must remember from the depression. Then moving on to the next topic. This is also a repeat topic because every year the questions are asked on this. So the PP means the postpartum. So the postpartum blues, postpartum depression, and the postpartum psychosis. Postpartum means after the delivery. So after the delivery of the baby, the woman will feel some disturbances in her brain functioning, and these are quite considered as normal until it is the blues and the if it is depression and psychosis, then it will be a little bit dangerous because this will be a severe variety. Let's see what happens in the blues. So the patient will be having symptoms like transient symptoms. She will feel sad and decreased sleep and irritable. So this is seen in most of the patients, like approximately 30 to 75%, and it is seen for 3 to 5 days, so very less period of time. And in most of the symptoms this goes in most of the patient it goes by itself. And if at all we need to treat the patient, then behavioral therapy is enough for the treatment of the postpartum blues, and as it is seen in such huge population, so it is the most common also. So the question can be asked that which of the following is the most common kind of diseases seen in the depression. So the question can be asked that which of the following postpartum disease is more common. So it will be the postpartum blues. Then moving on to the depression. Depression seen in approximately 10 to 15% of population, and it will be present during the pregnancy also. Can be present during the pregnancy and till 6 weeks post delivery. So the features will be like depression, anhedonia, suicidal thought, and the guilt. So for the treatment, behavioral therapy alone is not enough because the patient will be having the depression, the anhedonia, guilt, sadness. Okay, so along with that SSRI, the antidepressant drugs are also required. And if the patient is having suicidal thoughts, then we can do the CBT, cognitive behavioral therapy. Then the postpartum psychosis, it is seen in very few population, that is 0.1 to 0.2%, but it is the most severe form. And the symptoms, delusions and hallucinations are seen, and treatment is by the antipsychotic disease. So if a clinical case is given describing these features, you can also easily able to solve it. But in the question they can also describe things like 3 days, 3 weeks, 3 months. So you need to look at those points also, which will help you in solving the question. Like if it is the blues, then it will be presenting at the 3 to 5 days. Okay, if it is psychosis, then it will be 3 weeks, and if it is depression, then it will be 3 months, so 6 weeks post delivery. So like that, looking at the time duration, you can come to know what the examiner is trying to ask. So that was about the postpartum diseases. Now we will be discussing some points about the personality disorders. So the personality, it is classified into the 3 types, type A, B and C. The type A personality, he will be competitive, time urgency, and patient will be having anger and hostility. But the type B, they are the easygoing people and they are relaxed, they do not worry about the things so much. And the D, they will be negative, it is a type of a negative personality, and this patient usually have the social inhibition. So the disorders related to the personality, they are classified like the cluster A personality, and people who are paranoid or schizotypal, these come under this category, cluster A. So the paranoid personality means this patient thinks that the other people around him, they are involved in the conspiracy theories, and they keep on suspecting them. Okay, so patient who suspects on his neighbors or people towards him, people around him. Okay, then schizoid means these people, they prefer to be alone. They do not involve much in the social activities. They are emotionally cold and detached. And the schizotypal means they have the odd and the eccentric thinking and behavior. That means this patient will be thinking magically. The things that do not happen in the world, the patient will be describing and thinking about these things, the schizotypal. Then the cluster B classified into the antisocial. So antisocial personality means this person will be violating the rules and regulations, and he will be rude to the others, abusing of the rules, not following the rules. Okay, like that. Then the histrionic, these patients are dramatic, and they produce their emotions in an exaggerated manner. So these love to be the center of the attraction, and to gain the attention, these person will do the things in an exaggerated manner. Okay, then the narcissistic, so the patient who gives self importance or who is self obsessed, such kind of persons are called as the narcissistic personality. Then the borderline personality, these are the emotionally unstable patient. So this was a PYQ, and clinical cases are also asked on this, the borderline personality. So they have emotional instability and intense but unstable relationships. So these patients will be having problem in their relationships, multiple times breaking up and then patching up. Okay, so this was about the cluster B personality disorders. Now the cluster 3, it will be the avoidant means the patient will be rejecting the things, and he will not listen to the things told to him. And this person also avoid the social activities, means they will be not involving in the social parts, social activities. Okay, then dependent type. Dependent means these, as the name itself says, that dependent, so these people are always dependent on some or the other person, and they always expect the other person to take their decisions. Then OCPD, obsessive compulsive personality disorders. So these patients, they are highly sophisticated patients, and they follow many rules and regulations, and they try to be perfect. Okay, all the time, and their whole life will be lost in this being perfect. So they do not enjoy their time, or they do not have a good sense of humor. So this was about the personality and the personality disorders. So today in this video we have discussed a lot of things, like the basic things, then the dementia, hallucination, then schizophrenia, depression, and the personality disorders. So tomorrow morning I will post another video about the remaining topics. We will try to finish this subject in 2 days, as it is a very short subject, and also a lot of questions are not asked from this. Usually 6 to 7 questions are enough which are asked from the psychiatry. So in 2 days we will finish the psychiatry. So that's it in this video. Hope this video will be useful to you all, and share the video with your friends. Already I have uploaded the videos on the one-liners from the psychiatry, and also the important topics which you must know. So do watch that videos as well, to make your concepts clear and to make your studying easier. Thank you so much. Bye bye.